What can I expect from under-eye filler treatment?
Every day in my practice, I use fillers under the eyes to address hollowness, to camouflage eye bags, and to even improve the appearance of wrinkles. Under-eye filler treatment can be performed very quickly, and results can often be appreciated right after the procedure is performed. There are different ways to perform these procedures in this delicate region. I routinely see patients who come in having had filler placement performed by another practitioner, resulting in severe swelling, lumps, and irregularities, as well as dissatisfaction with their results. I'll explain how I approach injectable fillers under the eyes from the perspective of a cosmetic eyelid surgery specialist. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I perform cosmetic eyelid surgery every day for conditions such as hooded upper eyelids and under-eye bags. I also perform specialized eyelid surgeries such as Asian double eyelid surgery, eyelid ptosis correction, and eyelid retraction repair. I also specialize in revision surgery for complications occurring after eyelid surgery referred to me by other doctors. I routinely perform non-surgical injectable treatments every day for the under-eye area, for the crow's feet lines, for upper eyelids, and for lips. I'm also well known for performing a technique of structural volumizing derived from principles used in facial implant surgery to naturally enhance areas such as the chin, cheekbones, and jaw angle with thicker and longer-lasting hyaluronic acid fillers. A common question about under-eye filler treatment is if there are permanent options available, since fillers such as hyaluronic acid fillers are metabolized. I explained that prior to the introduction of hyaluronic acid fillers, I performed the placement of silicone tear trough implants. Although implants are permanent, facial aging continues, which means bone volume progressively diminishes, as does the thickness of the skin and the fat around the eyes, as well as the cheeks. Further, in my experience, patients appreciate the convenience, safety, reversibility of hyaluronic acid fillers, which are placed in my exam room with minimal downtime. This is in contrast to a surgical procedure with downtime that is more than a week. I'm able to use the same principles for facial implant surgery and create highly accurate enhancement by placing volume to compensate for natural asymmetries in the face, which just cannot be done with the same level of precision when placing facial implants. So what are the particular aspects of the under-eye area which need to be factored in when planning filler placement? Well, the under-eye area is highly vascular, so the risk of bruising needs to be reduced as much as possible. I perform these procedures with instruments called blunt cannulas, which allow me to avoid trauma to the blood vessels. This means that patients usually look good right after the procedure is completed. I approach filler treatment with the same level of care as I do with surgery. While filler treatment is not surgery, I do consider it invasive since the filler is being placed through the skin barrier. Although it's rare, injection of filler can go directly into a blood vessel or artery in this area, resulting in vascular occlusion, causing blindness. As the number of practitioners performing this procedure grows, many of whom are not trained or experienced at a specialty level comparable to an oculoplastic surgeon, there are more complications being reported. While there are risks to any medical procedure, these risks can be minimized by having a doctor who is highly trained and experienced and fully prepared to immediately address any complication. There is a small risk of infection from the placement of hyaluronic acid fillers since the needle or cannula can introduce bacteria from the skin surface and cause an infection known as biofilm on the surface of the filler material. Fillers can also become encapsulated, where the body forms a shell around the material. These issues can be addressed by dissolving the filler with the enzyme hyaluronidase. Hollowness under the eyes is often accompanied by the presence of dark circles. To improve the appearance of the skin, which is contributing to the appearance of dark circles, I often use PRP, or platelet-rich plasma. PRP is a concentration of wound healing and growth factors present in your blood, which is harvested by drawing your blood as you would for a routine lab test and concentrating the platelets into a clear yellow serum. Combining PRP with hyaluronic acid filler can have a synergistic effect and make a very nice impact on the tired look of hollow eyes with dark circles. Interestingly, I have found many people with under-eye bags come in for filler treatment because they see the hollow areas of the tear trough and don't realize that they also have puffiness. I use fillers routinely to camouflage eye bags if they are not too prominent by blending the transition between the puffiness and the adjacent hollow in the area of the tear trough. If under-eye bags reach beyond a certain threshold, treating them with filler may actually make the bags appear even more puffy. I see patients who had fillers placed elsewhere in this situation, and I use hyaluronidase to dissolve the filler. I then reevaluate in 2 weeks to see if filler is still a viable option or if lower eyelid blepharoplasty is more appropriate. I find it's important to educate my patient about the relationship between the under-eye hollows and the cheek areas. It's very common to see a deficiency in the projection of the cheek area just below the tear trough and the under eye as well as the cheekbone. This means that there is often a great opportunity to create a more significant improvement by combining under-eye filler with structural volumizing of the cheek and the cheekbones. Sometimes my patients express a concern about the potential for having rounded cheeks, which they see in their social circles or in the media. I explain that this appearance occurs when filler is placed just below the skin, which does not create definition. I place volume at the bone level as if I were placing a facial implant with minimal trauma and typically no bruising. This creates a harmonious relationship between the under eye and cheek area, which can be very flattering for the face as a whole. A hollow appearance under the eyes can have a significant effect on how people look at you. In my practice, I approach this area with an understanding of the deeper bone structure which comes from performing surgery. Essentially, I take an inside-out perspective, helping my patients recognize how cheek volume and skin quality under the eyes can also be improved to help them look better has been invaluable for my patients who then enjoy the benefits of looking more energetic and confident. It's important to remember that fillers are invasive procedures and should be taken as seriously as surgery. This means that it's in your best interest to take steps to ensure your safety, particularly in case a complication were to arise. Safety, predictability, reversibility, and minimal downtime are the guiding principles which I use to help my patients look their best. I hope you found this information helpful. Thank you for your question.